We are pleased to have one of our ACS-funded researchers, Dr. Shannon Stott, joining us via Skype from Boston, Massachusetts. Hi there. Are you there, Dr. Stott?
I am. How are you?
Good. Thanks so much for joining us. Hope you're doing well. So I understand that you're designing small devices for cancer detection. So what do these devices look like and how would they work?
Sure. So I can show you one of the devices.
Oh, that's great.
See it here. So it's about the size of a stick of gum. And the way that the device works is that we have whole blood that's drawn from a patient enter inside the device, travel through. And then what happens is that as the blood goes through, these ultra rare cancer cells are in the blood of cancer patients, and they will stick to the inside of the device to a cancer specific glue. So the cancer cells stay there, unwanted cells go away, and then we can actually interrogate those cancer cells to learn more about the patient's cancer.
So, I mean, this is big. What does this mean for cancer patients? You know, what's the goal of this research, obviously?
Sure. So our goal is that we can get information back to patients sooner so that we can understand in real time how their tumor is responding to the particular treatment. We also would like to ultimately diagnose cancers earlier so that when you're having your cholesterol tested at your doctor's office, that we could potentially have a device that would help you identify cancer earlier so that you could have more extensive screening. And then I think in the long term,
making it that easy, just going to a doctor's visit, you know, getting your cholesterol checked.
yes,
Yeah.
yes, that would be one of our real dream visions of what we could actually achieve in the near future.
Well, that's exciting. You know, what drew you to this particular area of research? And obviously, things like this, hearing you talk about it probably excites you the most, but what's the biggest thing about this project that excites you?
So what drew me to the research was that while I was a graduate student, so my background is mechanical engineering, and I was studying mechanical engineering down at Georgia Tech when my stepmother was diagnosed with stage 3B breast cancer. It was really hard to be that far away while she was undergoing treatment, and she was also undergoing very aggressive treatment at the time. And it was very frustrating that during that treatment, her tumor actually grew.
Oh.
And I felt that there had to be a better way to identify particular treatments that would work for an individual patient, and that you wouldn't just do what works for 90% of the population in your subclass. And that's where I started looking into using engineering tools to see if we could actually do something better. And I was drawn to the laboratory of Dr. Emmett Toner, where I started as a postdoctoral fellow, and we started working on designing these chips. Where the project currently stands is that this chip has gone through a few different generations of technology development. We're now working in partnership with Johnson & Johnson to bring the chip in front of the FDA next year so that we can actually have an international commercial product that we can distribute out to cancer centers around the world.
That's amazing, and thank you for all that you do. And obviously, you know, your stepmom was a huge motivation for you, and we appreciate it. Thank you for joining us from Boston. Thanks, Dr. Stott.
Well, thank you, and thank you to the Society for all the research funding. It's been phenomenal.